A 72-year-old lady with high blood pressure, diabetes, and anemia presented to us with palpitations and very low energy and a desire to get better. See what we did next. Tell us about this 72-year-old lady with diabetes, high blood pressure, and anemia who presented to our center.
So she came experiencing a lot of palpitations and racing heart, and that would also cause a lot of low energy. She was really concerned. She wanted to try to improve her condition by assessing the root cause because she needed help eating better, and that's why she presented to our office.
Wow. A patient with these conditions, high blood pressure, anemia, palpitations, seemed like a variety of different things going on. She had high inflammation, elevated hemoglobin A1C. So you would think someone like this would have to see multiple specialists. She would probably see a cardiologist or an electrophysiologist or an endocrinologist. However, these things can all be connected. And so if we think about the body as a unit functioning as one system, if we think of it that way, and we work on putting the body in biochemical and physiological balance, it's possible that conditions that seem as disparate as these conditions can all correct together. So I'm curious to see how this may turn out. What did we find on initial evaluation?
So her diabetes was not controlled well at all. The A1C was 9.1, should be less than 5.7 if you don't have diabetes. Her markers of inflammation were extremely high. Her bad type of cholesterol was also very high, making her higher risk of heart attack or stroke. And she did have some anemia as well.
Wow. Someone in her condition could be on the edge of the hospitalization if these conditions are not turned around pretty rapidly. So I think we needed to get to work fast. So how did we intervene with this patient with these complex medical problems?
So we focused on the nutrition first, and we met with the wellness team and put her on the nutritional cleansing program from the Garden Kitchen, consisting of raw plant foods level 0 to 4B, and she did that for about a month. And we also did some targeted supplementation with vitamin D3, B12, and some nitric oxide as well. That would help her blood pressure and circulation. And she also did an ozone therapy in the form of the EBU. Really helps with reducing inflammation, improving circulation, and cell function.
Wow. So this was quite an aggressive approach. Of course, the food, the nutrition being the foundation, and target supplementations. You'll hear me talk about this a lot. We use supplements or micronutrients in a targeted fashion. It's very important because it gets the best bang for your buck when you're using micronutrients in this fashion. So I'm really looking forward to see how this patient turns around. So how did this patient do?
She did really well, and after she finished her meal plan and the therapies we had, she lowered her overall inflammation by 85%.
Wow.
Her blood sugar was better on less metformin, and she lowered her LDL, or the bad type of cholesterol, by 34% in just 4 weeks.
And the A1C, did that also improve by just 5%?
5%.
While reducing the metformin.
Right.
Now, many of you who know about A1C, you may be a diabetic or you may know someone who's a diabetic. The A1C is the average blood sugar over 3 months. So you may be asking, how can you reduce the A1C in just 1 month when it measures the average blood sugar in 3 months? Well, actually, we validated this approach scientifically. In our studies, we showed patients on a defined plant-based diet were able to reduce the A1C significantly in just 1 month. So how would this happen? Well, the explanation is simply this. A1C is impacted by 2 factors. It's the average blood sugar over 3 months. However, the fluctuation of blood sugars in a given period of time, in the course of a day or a week, also can increase A1C. So the higher the blood sugar fluctuations, the higher the A1C. What we did was we reduced the fluctuation of blood sugar and therefore reduce the A1C. So this patient got better with the nutritional intervention because she had fewer fluctuations in blood sugar, was able to come off or reduce the metformin dosage. The other thing that's amazing here is that her anemia corrected. Typically we think that we need red meat to correct anemia. However, When you think of red blood cells, there are many factors that go into the production of red blood cells. And there are a lot of biochemical reactions that occur at the bone marrow, as well as other parts of the body, such as the kidney, that enhances red cell function. So the body is placed in biochemical balance. These biochemical reactions can occur more efficiently and therefore correct anemia. So this is what I think happened with this patient. So she had an amazing set of results in just 1 month. And someone who is 72 years old with such advanced illnesses, to be able to turn these conditions around in just 4 weeks is quite amazing. So I hope you got a lot out of this. And as usual, if you have any questions or comments, place it in the comment section. And until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.